Before I open it up for questions, I was struck by the program's comprehensiveness, and
Thank you.
yes, it's and particularly when I was reading it, hearing you explain it, it clarified a few things for me, but particularly the aspect of drawing from the students about their own experiences with social determinant of health. I'm thinking that at least in the School of Social Work where I'm located, when it's easier to talk about these topics when we're talking about the people we serve, those out there. So
Right.
we all can understand that, yes, people who are poor, people who experience this, people who, but when it comes to us, it gets very difficult, and at least where I'm located, these difficult or courageous conversations, as some students like to call them, are difficult for faculty. They're difficult for me, and they're difficult depending on one's identity. I might be more comfortable, I'm an immigrant, so I might be more comfortable talking about immigrant and how that might affect a person's ability to access services, to get good care.
Right.
But there are other identities, so to speak, that I'm less comfortable with, and how a model like this, which I completely agree with, how do you see what would be helpful for us, the committee, to keep in mind as we're thinking about this framework on what we would have to emphasize to places like, I'm imagining, I'm being a little stereotypical and I apologize, but schools of medicine where maybe talking about racism, talking about belonging to an LGBT community and what that means to seeking services. I can imagine it being very difficult if it's difficult for social workers, for example, and if it's, in your case as nurses, you had also, you thought about that obviously, and you brought social workers on board,
Right.
in addition to your opening up your home for students. So I wonder if you could just comment on that aspect.
So I will tell you that when we think about what else we can do for our students, one of the things that I know has to be addressed is us being willing to actually open up about our own experiences. One of the things that I do to address, to help my students to be more comfortable, is to tell them my own personal story. And they see me as Dr. Carter, and that's all they've known, and they don't know the Bridget Carter, or Bridget Weaver, who was a young child of very severe poverty, who lived in the hood and had a lot of experiences that they probably couldn't fathom because this is who stood before them. So helping them to get past this kind of identity and open up. You know, we talked about what we did as far as pulling out social determinants of health for them, but this happens over time. And one thing I say, you know, we put our students in situations, but we have to continue to mentor them. And if this is going to be part of our mentorship, whether it's a medical student or nursing student, we have to continue to mentor them and talk to them very openly about about what's going on in their life. You know, we had a young medical student who was just at one of our seminars and said that he had just had a very bad experience with one of our city police officers. And, you know, during this time, you know, he just really didn't understand it. He said, I'm trying to do good. It would have been a time where I probably would have done something differently, but I'm trying to do good. And so students don't understand that they are still victims of racism and other things, but they have to have the tools to move beyond it. So for me, it's providing them with the tools. It's not just saying and identifying what it is that they bring to the table, but how do we help them work through it, giving them strategies. And we're talking about coping mechanisms. You know, these stressors are real. And if they don't know how to deal with it beyond this day, it's not going to benefit them or their patients. They won't even know how to truly say, how can I help my patient, except to put them off on someone else.
Thank you.
Tony?
Thank you so much for a great talk, and I love hearing about the fact that you're addressing the fact that the pipeline of workers and the characteristics of the workers themselves, they're dealing with their own challenges individually, so that's an important part before they can help somebody else. So, and I like the evaluation component that you do, that you have a simulation where you have to see if they've changed the way they approach a patient, but what has been the feedback about their experiences once they get out into the real world of the healthcare setting that might not be quite ready to change itself and how they address social determinants of health and the tools that they have available to them?
And I will tell you, for these two cohorts haven't graduated yet. We do have one previous group of students. They weren't in the same program, and we didn't actually address social determinants with them. It was really more an immersion program. But as they go out into the community, that's one of their real complaints to me, is that, gosh, I wish I would have learned more about really how to understand my patient, because most of them, the ones that I know that are moving forward into their master's program, work with chronically ill patients. And so they come to them with very complex conditions. And so it's more than just about teaching this patient that this is the right blood pressure medicine. We know all that. But we also know that we have to address that, well, when I go home, my daughter's cooking for me, and she has a family, and she's not going to cook 2 meals, and this is what she cooks for her family. And so helping people address those kind of things. I wish I could tell you what they were gonna do. Now I can tell you what I hope they would do. I will keep you updated on their progress, though. And we really do have to continue to evaluate their ability to be successful in their new environment, because they're in a very safe environment right now. So once I kick them out of the nest and they move on, I do believe there needs to be continued evaluation, which I was taking notes about how to do that.
And hopefully they'll change the environment in which they're in.
That's the goal. That's the goal.
Brigitte, thank you for a presentation, and it's a wonderful program. I'm wondering if you can tell me how what your plans are in your next grant, or what you're thinking about in terms of, you've dealt with a small group and a small cohort of students. Mm-hmm. What challenges has that been for you in, I'm not sure how this group is perceived by other students, by other faculty, and importantly, what effect have what you learned been able to infiltrate the greater school in terms of how they address students? I mean, because these are self-identified, or they meet some sort of criteria, but I would bet that there are many others that are hidden who would benefit from similar services, experiences, or at least a consistent approach in terms of how faculty and staff deal with them. So that's sort of one question. And then in the evaluation, I would think that we would, and I wasn't clear when you talked about the simulation and the social determinants of health, whether you did a comparison as to this group versus the greater nursing community, because you're not responsible for teaching them everything about social determinants of health. Right. And you talked about how it was integrated into the curriculum as well. Right. So you might have a natural comparison there. So just some thoughts.
And you actually, there was so much I wanted to tell you, but I know my time was limited. But there's definitely, when you have this big community and you have these students, actually our students are highly revered. They have high expectations from our scholars. So when they come into this program, the one thing that I do love is that when any faculty member sees anything, if they think anything's wrong, they're calling me and saying, hey, Dr. Carter, one of your scholars walked out of my class today, or, anything, any type of behavior that I might be concerned about. But they actually feel like that these are the cream of the crop, because really they have been immersed in something that other students haven't been immersed in. Now, are we going to be able to provide this to the larger community of students who are so deserving of that as well is a good question, and I think that would be my ultimate goal. I'm making my wish list to the dean right now as we redo our strategic goals and plan, and I really feel like that there should be a way for us to do this for all students. I think that having this project first evaluated, because we don't have these students graduated yet, I can't even compare their second semester and their fourth semester or exit simulations yet. So in December, when I'm able to at least do a comparison there, and then also I did plan to bring in a few of our students who had not been immersed into the program to do the exit evaluations so that we could determine whether or not there was even a difference there. Hopefully there's not. Hopefully the curriculum is providing them with the content that they need to be successful in terms of addressing those with their patients. Did I answer everything for you? Okay.
Thank you, Dr. Carter. I think we're out of time.
Yes.
We would love, though, to be able to have access to you later on to follow up with more questions.
I'd
and
love for you
get more
to, but I
details.
do have a flight, so but my contact information is available, so.
Thank you.
Thank you.